welcome back. Well, today I am joined by Dr. Robert Princenthal, who is here to talk to us about a breakthrough new technology regarding prostate cancer. Well, Dr. Princenthal, nice to see you again. It looks like you're back at work.
I am, Lisa. Good to see you again.
Well, this is very exciting news. So you have a new breakthrough technology. Tell me a little bit about it.
Yes, we're proud to say that we're the first West Coast site to provide Tulsa Pro for focal therapy for men who've been diagnosed with low or intermediate risk prostate cancer.
Okay.
And this is a revolutionary form of prostate cancer focal therapy. For your audience, they may know that there are other types of focal therapy. That would include cryo, where a doctor would freeze part of the prostate. There's laser ablation, and there's something called sonoblate, which is delivered through the rectum. All of those devices have some weaknesses and have some risk of either unavoidable injury or a slightly higher risk of recurrence. So if you don't mind, I would like to show you a little bit how this device works and what makes it special.
Excellent. Let's take a look.
Lisa, for men who may be eligible for focal therapy, we feel this is a big unmet need because for men who have high-grade, high-volume tumor, they really need to be treated with standard treatment options, which would include surgery or radical prostatectomy or radiation. For men who have low-volume, low-risk disease, they can be managed on active surveillance or watchful waiting. But the majority of men fall into this in-between category where they have large volume of low-grade disease or smaller volume of intermediate-grade disease, and they may not want to suffer the harms of being overtreated, and they don't want to just watch their tumors. They want to do therapy. So this is an opportunity for less invasive functional preservation that doesn't include surgical removal.
Okay.
So Tulsa flexibility, we can treat whole gland, we can do half the gland, we can treat men who've been treated with radiation therapy who've had a recurrence, we can do treatment for BPH or prostatic enlargement to help men empty their bladder, and we can do both a targeted tumor ablation in men who have an enlarged prostate.
Mm-hmm.
So what makes this special is because the device is delivered through the urethra. So the energy is delivered from the inside of the gland out. And with our precise computer control and segmenting, we can design a accurate boundary so that we can spare here the neurovascular bundles to maintain a bladder and sexual function. This is called the hockey stick program. We can just do half the gland and we can spare the ejaculatory ducts, and we can, as we said, ablate benign tissue. So here's what the Tulsa device looks like. There is a probe that's inserted into the bladder, and these ultrasound crystals then cover the prostate, and the computer can control each of these 10 crystals individually because, you know, the prostate has a curved shape, so it's skinnier at the bottom and bigger at the top. So this way we can precisely heat the gland and not go beyond the capsule and reduce harms. So if you look at this little video, you can see the device being introduced with the tip in the bladder, and then there are 10 segments for each of the 10 crystal elements.
Oh.
And now you can see that we're delivering the heating. And you can see on the color map, the orange means we're heating the tissue to 55 degrees, which is what's been proven to represent cell death. And we can sweep this and completely treat the entire gland. And we can do this in about 45 minutes. This video is being sped up, but you can see the precise control that we can deliver, that there's no heating going beyond the capsule of the gland. We're not damaging the rectum. We're not damaging the neurovascular bundles. And we can effectively ablate the whole gland without an incision. So here we're almost done with the heating. So this takes about 30 minutes. And now at the end of the procedure, we remove the device. We put in a catheter to help the man drain his bladder. so that, if there's any swelling, that goes away.
Mhm.
And this whole thing takes about an hour and a half, start to finish. And for men, we have functional outcome data now for 2 years showing that there's almost no incidence of urinary incontinence. And for men who were potent and able to maintain an erection, after the treatment, 83% of men after 2 years were able to still perform. So
That's
it's been
great.
proven to be safe with great outcomes. And when you
Right.
compare that to standard surgery, radiation, or other forms of focal therapy, the Tulsa Pro clearly shows the lowest incidence of side effects regarding bladder, urethral stricture, or GI toxicity. So that's the summary of what I wanted to share with you and the audience about why we're excited about focal therapy with Tulsa.
That is really amazing. Now, a couple of things do come up in regards to questions. So, when a man is in that middle frame risk and he has these types of options, are there pros and cons to choosing this particular treatment versus the others?
Sure. Well, let's talk about the exclusion criteria. If a man has a large volume of calcium deposits in the gland, the calcium deposits will block the ability of the ultrasound energy to successfully ablate the cancer cells. So we always do a low dose CT study after the prostate MR to make sure that we can do it safely.
Mhm.
Many men have an enlarged prostate and they get a device called a UroLift to treat their bladder issues. Those devices create artifact and make it impossible for us to offer it for those men. And men with hip replacements, we have too much artifact to do this procedure safely.
Oh,
Those are basically the only exclusion criteria.
okay. Okay. And you said it takes about an hour and a half. Are they completely under during this process?
Yes, we administer general anesthesia for two reasons. We want the patient to be completely relaxed and asleep because any motion will make it difficult for us to measure those tiny temperature differences and allow us to be precise with our control and make sure we're only killing the cells we want to.
Right. And then another question that comes up is, once you've eliminated the cancer in that particular area, what about it coming back in another area?
Great question. Prostate cancer is just like breast cancer, it can frequently be multifocal. So to have men be included in this, we require that they have a standard 12-core ultrasound guided biopsy. And if there was a target seen on MR, that should be targeted in addition. So if the patient only wants to have half the gland treated to reduce the side effects and treatment time, we would still need to follow the patient to make sure they don't develop a second tumor 5 or 10 years down the line. Many men, because of that, will elect to have whole gland treatment initially so that there's very little risk of developing a residual or new cancer.
Now, since this is a fairly new treatment option for patients, what's the likelihood that insurance wouldn't cover it?
100%. Right, right now, unfortunately, that's another challenge. This is such new technology. Even though it's been approved by the FDA, we're working with the outfit called CMS, which is the government's arm with Medicare to create codes so that it can be covered by insurance. So unfortunately, right now, men would have to pay cash or use their HSA accounts or a credit card, but unfortunately, it's not covered.
Yeah, that always seems to happen, doesn't it? When you have something new and fabulous that comes in, it takes a while for insurance to come on board. So hopefully that'll happen sooner rather than later.
We're hoping so because for the healthcare system, the cost of this is less than radiation therapy now of what they're covering. It's comparable to the overall cost of robotic surgery, but there's fewer adjunctive costs because men don't need continence supplies, they need less erectile dysfunction medication. There is no incision, there's no recovery. They go home with Tylenol, and within a few days, they can go back to work and regain their activity. So it's an overall less expensive solution to the healthcare system.
That is remarkable. Well, wonderful. Well, thank you so much for sharing that with us. Is there anything else you'd like to let us know about?
Well, if men wish to get more information about Tulsa Pro to see if they're a candidate and if they feel that this treatment option would be optimal for them after consultation with our team of doctors, they can find us on our webpage link that I know you'll post. And they can always reach out and find me, and I'll be happy to talk to them at any time.
Thank you so much. Awesome. I appreciate the information.
Thank you for letting us get this information out.
All right. We'll talk to you again. Thank you. And we'll be right back after this.